everyone, it's Cheyenne and welcome back to my channel. Today I wanted to talk about working in a clinic versus working in a private office as a dental assistant and just my personal experiences with that. I have worked in a clinic, actually a few clinics and a few private offices, and there definitely are some ways they are different and some pros and cons of each. Clinic versus private office. Now, in clinics, there are usually a lot more hours available other than a private office. Now, you could still find a full-time job at a private office, but if that dentist, since in that private office, there's usually only one dentist, maybe two, if those dentists go on vacation, you usually don't have a job. You don't have work for that time period. I once worked in a private office and the dentist was gone for the whole month of October. And luckily, he still let us come in a few times and clean and do some paperwork. And he did have an outside dentist come in and do some like oral surgery and things like that. But it wasn't full time for that whole month of October. I still luckily got about 30 hours a week, but it definitely wasn't as much as I was making prior. So that's definitely a con working in private office, is if your dentist is out, you usually don't have any hours, and that can be a struggle. Clinic, the clinics I've worked in have up to 12 dentists working. So there's usually always hours available, or there's an assistant out sick or someone's on vacation. So you can always get that 40 hours a week. That is something I love about clinics. It's just easier to depend on because there's so many more hours available. Benefits. Now, like health insurance, dental wise, things like that. The first clinic I worked in did have health insurance, but it did not provide dental, which sounds so funny to people. They're like, how do you not have dental insurance as a dental assistant? But most places I've worked in, except for my job now, did not provide dental insurance. Usually, if you're in a private office, the dentist offered like one day every few months that he would do free dental work on staff, but they usually did not pay for dental insurance. In the state of Oregon, it's not required by your employer to offer that or pay for that, only medical. So the clinic usually provides better health insurance, I think. I think they usually charge a lesser amount. There's usually like a fee per month. Like now I think I pay like $50 a month for health insurance. In the private offices I've worked in, one office, you had to pay the full premium up until a year, and then after a year of you working there, the dentist paid that for you, and the premium was like $200, so I was paying $200 a month to have health insurance. But then after a year of you being there, the dentist fully covered it. And then another office I worked in, the dentist did cover, I think like 70% of the premium cost, and I just paid the other percentage. So benefits are roughly the same, sometimes a little bit more expensive in private offices, and to my experience, not as good. Clinics, I do think, offer better benefits. But again, I'm not saying that that's in every case. Some private offices, I'm sure, offer great benefits. But definitely talk to them about that when you go into for your interview, because ask them how much you're gonna be paying out of each paycheck for your benefits and what you're actually gonna be getting, your 401ks, things like that, because it's stuff that's gonna be taken out of your paycheck. So you definitely wanna make sure that you're aware of that. So something else that's different between clinics and private offices is usually clinics are a lot faster paced. You're seeing a lot more insurances, you have a lot more patients coming in and out. It is more of a go, go, go type of schedule. Private offices can be a little bit more laid back. There's only one dentist, so you kind of have, maybe a patient every hour, maybe two. Clinics, there's a lot going on. They have to see emergency patients, things like that. So I, in my experience, do feel that clinics are a lot more fast paced. So if you're not really into running around crazy and getting patients in and out and all this kind of stuff, I would definitely probably go for a private office. They're a little bit more laid back. Just my personal opinion. I'm sure there's lots of private offices out there that are crazy. I've worked for a private office that was very crazy, but they did also take the state insurance, so they saw a lot of those patients, as well as in other private offices sometimes only take cash or they don't take any of the state insurances. They might take like a private insurance or cash. So usually their patient flow is not as crazy or hectic. Also, different clientele, different patients. When working in a clinic, you definitely see patients with more decay. Also, if you're a hygienist in a clinic, you're going to see people with more like perio disease that are going to need like deeper cleaning, SRPs. In clinics, you definitely do a lot of extractions, like dentures, partials. It's definitely a lot more decay. Just because these are people that are on state insurances that maybe have not had the money or the means to go to a dentist, so they're just getting this, or they haven't been to the dentist in years, or things like that. So these are people that definitely have more decay in their mouth, or perio disease, or bone loss. In private office, since they are paying cash or they have a private insurance, they usually have been going to the dentist for a long time, or they have the means to pay for dental work. So when I worked in a private office, there was a lot of fillings, like bleachings, things like that. As in clinics, it is a lot of extractions, just a lot more work. When patients come in and we examine all their teeth, there's usually a lot more to be done than like in a private office. Not in all cases though, but just my personal experience working in that type of setting. Also, in a clinic versus a private setting or private office, is kind of more, I think, close-knit. You have one doctor usually, you have a couple front staff people, maybe a couple of assistants, a hygienist or two. So you really get to know the people in the office and you can form a very tight bond. Clinic, you can do the same thing, but there's a larger amount of employees. So, you are working for a corporation. You're not working just for that dentist. So a struggle that I've had sometimes in clinics is I first started out in a private office. So to me, the dentist is my boss. And sometimes when you go into clinics, you and the dentist are working for a corporation. So really the corporation's your boss and not the dentist. Not saying that you don't still respect the dentist and listen to what they say, but it's a little bit of a different scenario. The dentist doesn't own the office that you're working in, the corporation does. So you kind of have to make the dentist happy and the corporation, which sometimes is a struggle. But, I'm not saying it can't be done, because it can be done. Just a little bit of a different scenario. As in a private office, that dentist owns the building, he owns the practice, you are working strictly for him, and what he says goes. As in, a clinic, the dentist might want to do something, but then the corporation might be like, no, we're not going to do that. So there's different things like that. Also, clinic versus private offices. Private offices, again, you work for a dentist, smaller amount of employees. What I like about that is you can make a better bond with the people you work with, get Christmas presents. Usually the dentist is a little bit more giving in private offices, like Christmas time, Christmas bonuses, presents, all the staff is. You can do that with each other. Now in clinics, again, you're with a corporation. So sometimes the dentist that you are paired up with, or maybe not even work all the time with, you don't have that tight bond with. Sometimes you do, but sometimes you don't. So like bonuses or things like that are sometimes more uncommon in the clinic lifestyle. But also in clinics, you could have a corporate bonus that you're working towards. Some clinics, maybe even some private offices, not ones that I've worked in, but some clinics offer bonuses for products that have been sold, things like that. It's just a different type of connection. There's just more people involved in a clinic than a private office. Now, I get the question a lot about would I rather work in a private office or a clinic, and it's tough because there are sides that I like to both of them. I work in it's kind of tough. The situation I'm in now, it's a corporation, but it's a small office. So I kind of get the best of both worlds. But me personally, I think that I would work in either one. Now, I am hoping to have kids in a few years, so I'm probably going to stick with the clinic, especially the place that I'm with now, because their benefits are really, really good. And I do like where I work now. But I think maybe as I got older, I'd probably want to switch to a private office just because they're not as busy, and they are a little bit easier. I don't want to say you don't work as hard, because that's not true. There is private offices that I've worked in that I work very, very hard in. And I'm sure there's private offices that are very, very busy, but clinics are such a fast-paced place, and it's strictly just about getting those patients in and out, that I think as I got older, I would probably want to switch to a private office. I think maybe just starting out, I would probably go to a clinic, because you learn a lot and you learn a lot quick, because you see a lot of patients, you see a lot of different things. But as you get older, maybe a private office would be better, because when I have kids and stuff, I don't want to be working, 50 hours a week. Right now, I'm averaging about 45 hours a week, sometimes 50. So I'm working a lot. And I think as I got older, I'd want to go into a private office, because if the dentist took, a few weeks off, it'd be like a nice little vacation, or, a little bit more relaxed and not trying to get all these patients in and out. So I guess I really didn't answer the question, huh? But I think they're both great. I think clinics are great. I think their benefits are better. Sometimes I think pay too. I think they do pay better, because I think that you are working, you're seeing a lot more patients. The patient flow at clinics is usually a lot more heavier than a private office. My friends that work in private offices do make usually a couple dollars less than what I make now at a clinic, but I think it just has to depend on what's right for you. If you want more of a laid back atmosphere, I'd probably go for a private office. Now, if you want to learn a lot and you like the fast pacedness and you want to be running around and be busy, and I would definitely go for a clinic. It definitely kind of depends on where you're at in your life. But yeah, those are the differences between a clinic and a private office to me. Some people might have different opinions on that. And if you do have different opinions, please leave them down below. I love that you guys talk about these things down in the comments down below. And if you have any video suggestions, let me know. And please subscribe. And yeah, thank you guys for watching this video. And I'll see you in the next one. Bye, guys.